level setting. Hey everyone, welcome to session 2 of the Health Center Preparedness and Response Forum. This session is focused on preparing to support patients with access and functional needs. And we're so glad you're here to join us. And we are going to just jump right in. So next slide, please. And many folks are familiar with Zoom, but we are in a webinar today, which means that all attendees' cameras and audio are turned off. And we do encourage you to participate with us via the chat and the Q&A box. We invite you to share any introductions or comments in the chat and any questions you have for our speakers in the Q&A box. We also want to remind you of the keyboard shortcuts for each function and the option to turn on closed captions. So if you'd like captions today, you can click the closed captions button and select where they go on the screen. And for any other access needs, please message Kyronisha in the chat. And for my own access needs today, I obviously am reading from a script. Slides are going to be shared in the chat for all of those people who do better following along live, and we will release a transcript and recording of this session along with the slide deck within a week to all registrants. Next slide. This forum is a collaboration between 11 different national training and technical assistance partners, or NTAPs. NTAPs provide free training and technical support to health centers in a manner that increases patient safety and health outcomes to effectively serve health center populations. To learn more about the NTAPs and the individual priority populations that they serve, please visit the link in the chat. Next slide. My name is Kara Skillingstead. I use she, her pronouns. I'm the Associate Director of Healthcare Transformation at the Association of Asian Pacific Community Health Organizations, or APCHO. I'm a mixed race woman in my mid-30s. I have brown hair that's pulled back, and I'm wearing a green shirt and wire glasses. And I'm going to pass it to my colleague to introduce herself.
Hi, good afternoon, everybody. Thank you for joining us. My name is Elena Boyer, pronoun she, her. I am Senior Director of Programs at the National Healthcare for the Homeless Council. And since Kara described herself, I am in a gray sweater with white stripes, and I'm also wearing glasses with my hair pulled back.
Thanks, Elena. Next slide. Oh, you went there already. Okay, so today we're going to cover some context for this topic and how it relates to the health center program. And then we'll have a moderated discussion with a couple health center subject matter experts who can share some promising practices and insights for emergency preparedness. And then we'll have some expanded resources for preparedness and accessibility at the end. Next slide. So what is access and accessibility? This session says it's about access and functional needs, but what do we mean when we talk about patients with access and functional needs in the context of emergency preparedness? When hearing about this topic, most people or many people will picture folks with ambulatory or mobility disabilities stranded in the midst of a natural disaster. And while we are including folks with physical disabilities in this topic, access and functional needs goes far beyond cognitive, mental, or physical disabilities, and includes many other disabling conditions that prevent folks from accessing the health center and equitable and quality care. So Toby Finch reminds us that societal systems are developed and implemented based on specific policies, attitudes, and institutional practices. It's not biology that disables people, it is the mismatch between abilities and the systems not designed for them. And further, the US Census Bureau shares that as a public perception of disability, as a public, the perception of disability has changed over time. So have the goals of programs supporting people with disabilities. Today, the emphasis has shifted to supporting independence and promoting involvements in all aspects of society. So disability and overall accessibility are complex, multidimensional, and ever-changing. So we invite you to join us on this lifelong journey to lean into empathy, understanding, and engagement to transform healthcare in a way that's responsive to our entire patient population, as well as our shared humanity. Next slide. And what we're going to talk about today are focuses are language access, digital and tech access, and then outreach and engagement strategies that support patients. Our speakers today will explore these topics by discussing strategies that health centers can use to prepare in advance of emergencies, to support their patients who are experiencing a myriad of disabling conditions. They'll outline resources and practical strategies that you can implement now in your emergency preparedness plans. And they'll explore reasons and promising practices for outreach and engagement to the communities you serve so you understand who and where your patients are in the event that they can't make it to the health center during an emergency. And we acknowledge that we won't have time to cover every aspect of this complex topic today or to be perfect in our coverage of the topics we are discussing. So we encourage you to keep the conversation going in the chat, review the supplemental resources, and reach out to us, and whether to share feedback or for requesting more information, support, or technical assistance for how to apply these practical strategies at your health center. Next slide. Health center populations often exist at the intersection of multiple marginalized identities and are therefore disproportionately impacted by emergencies. Emergencies often reveal gaps in understanding of and preparation for the far reaching effects of systemic inequities and structural poverty in health center populations. Health center populations such as elders, people with disabilities, unhoused individuals, agricultural workers, residents of public housing, migratory populations, minoritized and racialized communities, and sexual and gender minorities bear complex intersections of health disparities that exacerbate issues during emergencies, while also leaving deep scars that influence their perspectives and interactions with institutions like health centers. So, health centers must ensure that they're prepared to offer support and services to their populations and that those services are inclusive and culturally responsive. Finally, when developing resources, services, or supports, it's important to consider an intersectionality framework as impacts on access may be compounded by multiple aspects of identity, including race, ethnicity, age, gender, sexual orientation, and more. Next slide. Health centers must prepare in advance of emergencies to impactfully serve and meet patients with access and functional needs. And this goes beyond physical disability and mobility issues. Some key considerations to keep in mind are that health centers must incorporate preparedness and planning to support patients not only within the health center, but beyond clinic walls. This includes considerations for folks who have physical, cognitive, and mental disabilities, as well as those with language access needs and folks with other disabling conditions, such as houselessness, lack of access to resources or power, or other acute conditions that may prevent people from getting to the health center. And further, in this digital age, accessibility is impacted by tech literacy, digital literacy, where people live, and what access they have to broadband and electricity in general. Next slide. Health centers can know the needs and challenges of their patient populations, including language, level of education, level of literacy, cultural practices and customs, and more through data collection or just understanding and getting to know your communities. Resources, emergency alerts, and other communications should include in-language educational materials in print, visual, and audio formats. Partnerships with culturally specific agencies that understand the cultural nuances, linguistic barriers, and social stigmas that can impact access to resources are critical for fostering trust, rapport, and building relationships between health centers and patients. And finally, collaboration with trusted leaders and organizations can significantly increase the effectiveness of outreach programming, translation efforts, and improving community readiness to respond during natural disasters and other emergencies. Woof, that was a lot of me talking. So I'm now going to pass it to Elena to introduce our esteemed panelists.
Thank you so much, Kara. We have shared a lot about the multiple impacts on health center populations and would now like to turn your attention to our speakers. Today, we have with us Tom Vu. Tom Vu serves as the Executive Director of La Maestra Community Health Center in San Diego, California, with experience in compliance and risk management. Tom is dedicated to serving underserved and vulnerable community populations. Tom is passionate about fostering a culture of trust and innovation, ensuring that La Maestra continues to provide high quality, culturally competent care through its integrated circle of care model. Secondly, we also have Shane Shen. Shane Shen is the Chief Operations Officer for Hope clinic in Houston, Texas. She has over 10 years of experience working with the community and advocating around various Asian American health issues. Shane works to ensure compliance, efficiency, and growth, and works with the leadership team to do strategic planning. We will invite our panelists to turn their cameras on, and we will stop sharing our slides during this conversation. All right. While we're getting situated with our panelists, we would like to start with a thanks so much for joining us today, Shane and Tom. We are lucky to have you with us and learn all about your expertise. So, the first question that we would love to hear insights and feedback are, what does inclusive emergency preparedness look like?
Yeah, thank you for having me. I appreciate it. I'm glad to be here. I think inclusive emergency preparedness. I think it really starts with understanding the needs of our communities, which are really unique. So inclusive means having systems to make sure that no one gets left out or no one gets left behind. And I think that's addressing barriers like patients who have physical limitations, who have language differences, and have limited access to technology. So telehealth lets us provide care without patients having to travel, which is a big benefit to patients with mobility issues or chronic illnesses, especially during emergencies. During the pandemic, we worked really closely with patients with disabilities to make sure that they could access telehealth services. And we learned that some didn't have the necessary technology, so we provided devices and we set up digital literacy training. And so that same model is now part of our emergency preparedness planning. Beyond telemedicine, I think our mobile clinics play a big role. So these mobile clinics, they bring medical, mental, behavioral health services right to the neighborhoods that need us the most. And they're staffed with providers and medical assistants and community health workers who speak the languages and they understand the cultures so that patients feel comfortable and they feel understood. Our transportation fleet really helps provide wellness checks, and they deliver medications to supplies to people who can't leave their homes. So our vehicles are equipped to help patients to get to our sites quickly if they need to, and it's especially important for underserved populations, especially people with disabilities or patients living in remote areas who may not have access to healthcare during an emergency. Language barriers are a big one that can make accessing care during an emergency really challenging. So we've built an infrastructure to to bridge those gaps. And for us, our medically trained cultural liaisons, they're at the heart of this because they bring really important information to patients in a way that respects their language and their culture. And cultural liaisons for us are much more than just translators. They're culturally competent team members who understand the needs of our patients. And especially in emergencies, they really help communicate information and make sure that patients know what resources are available and how to access them. So, and for patients who don't have access to technology, we use a mix of in-person outreach and creative solutions, I believe, to make sure they stay connected. We still continue to send out flyers in native languages, and those are still an effective way to share information. For patients who can't be reached through standard methods, or community health workers help. Our cultural liaisons step in to perform wellness checks or provide resources right to the community. And so these kind of proactive things make sure that patients, regardless of if they have access to technology, they are still informed, they're still supported, and so I think you need trust and participation in any emergency plan. I think patients really need to believe in the systems that are in place, and so communication plays a big role in this process. And so I think that's why the question is really important. Most of us already have our emergency preparedness plans in place, but thinking about inclusivity, I think it brings a deeper level of detail. So it's not just about having the systems; it's about having buy-in and participation with everyone.
Thank you so much. I really appreciate, and I wrote it down, medical, cultural liaisons. I
Yes.
really love that terminology, and I think it's so important in building trust. And sounds like you're really meeting folks where they are. So, Shane, we'd love to hear from you. Same question of what does inclusive emergency preparedness look like for you at Hope Clinic?
So Tom said it really well. Two of the critical pieces is the communication piece as well as the trust piece. During the COVID, one of the success story is our collaboration with the APCHO to be able to develop the community health advocates, where we recruit leaders as well as lay workers from hard to reach population in order for them to be able to be trained on, like Tom said, community health work, community health worker to be serve as the bridge as well as the legwork into the really hard to reach population. Hope Clinic itself, we were established and we still are the Asian American Health Coalition of Greater Houston. So for most part, a lot of the health, mental wellness, social and the physical well-being of the individuals that we serve stem from actually having excellent social service partners around the Greater Houston vicinity as well as nationally. One of the things that I wholeheartedly believe is when we do the reach itself, it has to be both upstream as well as downstream. Upstream wise, to be able to communicate some of the disparity as well as the challenges and things that we are finding from our community health advocates, or what we call CHAs, um, the information that they're able to capture from the Rohingyans, from the Afghans, from the Chinese, the Vietnamese, and being able to then for us to be able to push that upward to the health department, to our state representatives, as well as national partners. Part of the thing is resources very limited, and we want to make sure during any type of disaster, whether it's like the pandemic, whether it's a weather related or something as minor as just a local outbreak of a particular transmittable disease or incident, that we are able to also gradually work with the media so that there is cultural and linguistically appropriation information passed down to the community that are accurate. So there's no speculation, there's no false information. And the inclusiveness itself, you have to be mindful. Is it also gender? So it's not just the cultural and the language aspect. Is it targeting the women of certain population? Is it targeting men of a certain population? Or are we mindful of adolescents, the seniors, and like Tom had said, those with limited technology access and ability to be able to communicate via text or email? So how are we then able to bleed that information communication wise to those individuals who may rely on the television, who may rely on the radio, so or newspaper, so that that form of communication is accurate and it's also able to not for those individuals not to rely on friends and families word of mouth that information is correct.
Hmm. I love the power behind the bidirectional conversation, listening to the community to inform the work and protocols for emergency preparedness and being the voice of what they need to really build that trust. So I really appreciate it in the different modalities of visual on paper and audio. So that's really wonderful. Thank you so much. We'll move to the next question. How do you engage with communities to incorporate, and some, I believe some of you touched on this a little bit too, but if you wanted to expand, please feel free. But how do you engage with communities to incorporate accessibility into your emergency preparedness planning? Are there any partnerships that you consider when you're preparing, and what does that look like? So, Tom?
Yeah. I do think you have to prioritize community relationships to make sure that the work you're doing isn't just practical, but it's also responsive. It takes time to build trust. And for us, that means being proactive and working with local community-based organizations, faith-based groups, and schools. And then that makes our connection stronger with entities like churches and shelters. So we reach out to people who might not come to our clinics, but they still need support during emergencies. And a good example of that is our partnership with refugee resettlement agencies like USCRI. and USCRI stands for the U.S. Committee for Refugees and Immigrants, where we've learned about specific increases in populations in certain neighborhoods. And we build new relationships that haven't been established yet. We can be responsive to changes in demographics and provide support for new arrivals, provide translated materials and do health screenings and provide connections to social services. Also through the Medi-Cal Justice Involved Reentry Initiative, we're here to support incarcerated youth and adults. We connect them with healthcare services, and that includes medical care, behavioral health support, addressing the broader social determinants of health. We work with local educators there, counselors, juvenile support programs to make sure that they have access to the care and resources that they need. And that includes helping runaway youth, special education students, and kids in state custody. We work with these groups and incorporate their needs into our planning. Our community health workers, CHWs, they also play a really big role. They meet with patients in their homes and they assess their living conditions. They advocate for resources to make sure that they have safe and stable living environments. So, for example, they help elderly patients get refrigerators for insulin storage, or they've arranged for home weatherization to prevent accidents. And that gets coordinated through the insurance plans, the health plans, and with the local utility company. So these kind of small, but really the really meaningful kind of interventions, it really makes a big difference, especially during emergencies. So, accessibility is a big part of our planning. I think it starts with our team. We focus on recruiting and hiring and retraining staff who really reflect our community, the demographics of our community, and that's bilingual or multilingual employees. And it helps us understand and meet the needs of our patients, whether they're immigrants or refugees or individuals who have physical or behavioral health challenges. I think people want to feel confident that the systems that we have in place are reliable. So that's why our planning just continues to change. It evolves, and it is guided by the feedback that we get from the community.
Thank you. I appreciate that. I think you hit on the nimbleness that we have to be in as communities change, as needs change, and being able to flex with that and kind of build the partnerships and relationships you need with those who have established trust in those communities as well. Thank you so much. Shane, similar question to you. Happy to repeat it. It's just really kind of how do you engage with communities to incorporate accessibility into your preparedness planning? So what other partnerships do you bring into the mold?
So for us, as a coalition, health coalition, one of the things that we wholeheartedly believe is it has to be a win-win situation. Many of our partners, exactly what Tom said, partnership itself is really critical, and having to have a broad network of collaborative organizations that have different resources, different capacities, different ability with different groups that they serve is really instrumental in being able to broaden and be able to capture the population in need, especially during crisis. But one of the things that we are also aware of is we ourselves, as a federally qualified health center, we must have a very solid, very resilient crisis preparedness communication plan within our infrastructure. With that said, that plan itself must have continuously reviewed and up-to-date information of who's the partners, who is actually the contact of those agencies, as well as what resources and what services they provide. A lot of times funding comes and goes. One year, you may actually have an organization that is able to provide food and meal distribution with a pantry. Maybe something may have happened, and next thing you know, they may have lost that resources. So it's actually really critical to also always stay in touch with those agencies, confirm and make sure that the agency still has those resources when there's any major crisis, that those information that you're delegating to the clients, it's accurate. So with that, also, we want to make sure that if there's any identified need for any particular resources that's in need, you communicate and you work together with those partners to make sure that somebody has that resources, or identify another organization that may have that you can always bring into the fold. So that's an ongoing work at all times, mainly because you never know when emergency or crisis may happen. And so with the changes of funding, with the changes of resources, it's always very important to stay engaged with those partners and also communicate with them what they do have, what they don't have, and modify your plan.
Thank you so much. I think in keeping those references and resources up to date are so important. I know we talk a lot about pharmaceutical needs or people needing their drugs and knowing what's in stock and maybe unavailable, maybe even for a minute during emergencies. So thank you both for that. This follow-up question also has been touched on a little bit. So if you wanted to add more to this, that would be great. This is more of a question where we were talking about meeting folks where they are. And so this question is focused on how do you integrate accessibility into your programs slash service delivery to reach patients beyond clinic walls? So, Dr. View, I heard you mention mobile clinics and those types of things. I know particularly in the homelessness setting or unsheltered setting, street medicine and having to trek into certain locations or access to shelters, and what does that look like? So if there's anything else you both wanted to add in terms of what other service delivery programs do you think about for folks outside of the clinic walls, please feel free to share.
Yeah, that's a great question. We try to integrate accessibility into every part of our delivery. And so that means meeting patients where they are, whether it's, physically or culturally or technologically. And like I said, telehealth gets rid of the need for patients to travel. So, and that's a game changer for patients who have physical limitations or transportation barriers or busy schedules. And especially with telehealth flexibilities now permanent, it'll continue to be a big part in keeping care accessible. But it's also intimidating to patients, also the technology. And so again, that's where our cultural liaisons step in and they help patients set up those telemedicine visits and walk them through the process, everything from logging in to understanding their care plans so that it's accessible and practical for everyone. Also, we participate in California's Enhanced Care Management. It's called the ECM initiative, and that brings whole person care to the patients, right to the patients with complex needs like chronic illnesses or housing instability. And for many of these people, clinic visits aren't possible. So we'll bring the care to them. We'll arrange for transportation, address food or housing insecurities. We'll even coordinate in-home care for them. So if a patient doesn't have access to the technology that's needed for telehealth, we'll find solutions for providing devices or for enrolling them in managed care programs that do have in-home support teams. Also, during emergencies, our call center transforms into a hub, sort of. Our call center is usually used for administrative purposes like scheduling appointments. But during a public health emergency, we can coordinate our call center specifically for emergencies, and they can make outbound calls and they can receive incoming calls. And the telephone lines can be established for telephone triage, and that's where people can get up-to-date emergency instructions and they can get guidance in different languages. So that's been super helpful. We've also integrated mass texting through our EHR system to send notifications out to patients. So the texting usually is used for confirming appointments, but if there's a wildfire, for example, patients could get a text saying like, "Hello, this is La Maestra. Due to the fires, your appointment is now at our National City Clinic." And then patients can confirm with a quick reply to make sure that we stay connected. Like I mentioned before, our mobile units, they take care directly right into the neighborhoods. They offer all of our services, medical, dental, behavioral health, and it's staffed by the community health workers, the cultural liaisons, and these teams, they speak languages and understand their cultural nuances. And it does create a sense of trust and comfort, which is really important. And sometimes care really means meeting patients at their homes, especially when the barriers are tied to their living arrangements or their living environments. So we have partnerships with local utility companies like San Diego Gas and Electric here in San Diego, and that helps patients get priority support during outages, power outages. So by identifying patients who need or rely on medical devices, or they might have mobility issues, we incorporate that into our visits, and we can integrate them into our broader emergency preparedness plans. For instance, like if there's an earthquake or fire that impacts their home, our teams are already familiar with their needs and they can work to provide solutions like temporary housing or transportation or just relocate them to safer areas. So, through telemedicine, through in-home visits, being proactive with outreach, getting creative with digital access, we try to extend care to patients no matter where they are.
Yeah. Thank you for really bringing that whole person perspective and thinking about, while we know there's complex health issues that might be going on with an individual, there's so many complex social issues that also need to be considered in the response and preparedness. So thank you so much. Shane, did you want to share a little bit more about what your care for folks outside of the clinic walls looks like as well?
So I completely agree with Tom in the utilization of technology to be able to communicate. There's different platforms that are out there right now that interfaces with your electronic medical records that will enable you to be able to push out mass messages and communicate with the clients that your health center serves. Another thing is with our community partners, we actually even have group chat forums that if we send out the messages itself, everybody would be able to get that as a group network. That's also really critical. Social media is also very, very instrumental, being able to work with different population who relies on the different the information that they can actually get from their social media apps. Either in certain languages. Normally, when we push out various social media, we're very mindful that the content itself is also language friendly. Another thing is we wholeheartedly believe that our partnership with the local health department as well as the state health department is really instrumental. Part of which is during any major disaster, they're interested in reaching the broader population. They would be looking for partners as well, be able to trust and be able to then mobilize and engage various other hard to reach groups, which then we can then be the instrumental liaison to bridge to our other hard to reach in language as well as identify the resources that they need. And I think part of which is you never know when the disaster would happen. Understanding how and what to be able to prepare for. For example, Texas is one of those states that does not have Medicaid expansion. And so it's also very limited in the health resources that the Texas Health Department would be able to offer. So being able to then leverage the funding and resources with your local health department to be able to then provide out in the community a fair drive-through vaccination or senior events or any type of like water resources, ice resources is really critical, mainly because I think for the most part, we're still very behind progressive states such as California in the areas of being able to leverage the different type of coverage as well as the different type of health and human services to be able to then have trickle down a lot of the human resources such as home visits and whatnot. And that's something that at least even for our health agency, we're gradually building as well. But in the meantime, we pretty much rely on various partners that had bits and pieces, such as a senior community centers, the children's after school programs and whatnot, to be able to then have smaller events and reach smaller population during those gatherings.
That's amazing. And I want to point out that you brought up two things that I think are really important and that I remember coming up and experiencing through the pandemic was really the state policy levels and what role that plays in preparedness and what you can and cannot do. It was so interesting to see that variability across different areas. But also, I appreciate the partnerships you brought up with other local authorities or agencies. And I immediately think of, the partnership and building and the importance of health folks being at the table of your emergency management group, wherever that might sit for you, whether it's in public health departments or whether it's in more of your government offices. And so um, those are really important. So thank you for bringing attention to both of those in the larger planning process. Um, we have a follow-up question. This is more of a question around, okay, we meet the requirements that we need to meet for emergency preparedness, but how do we go beyond that? So the question is, what are some ways that your organization goes beyond just the ADA compliance to support patients with access and functional needs? So in language alerts, data collection, how do you go beyond just meeting that bare base minimum?
Yeah, I think ADA guidelines are a baseline. It's not just about meeting the legal requirements, because patients have mobility challenges, they have cognitive disabilities, they have chronic health conditions, are veterans. There are a lot of unique circumstances. So we've invested in backup generators, and that's really important in keeping operations running during power outages, to continue care during emergencies, especially for patients with disabilities and who have medical dependencies. It'll keep our operations running for medical equipment like ventilators, mobility devices. There's backup power for refrigerators and freezers to keep the medications like insulins and vaccines. So that's super important. We also support patients through our, I think you mentioned it before, through our on-site food pantry, which is really more than just handing out food. We can be prepared for emergencies. We stock non-perishable foods and provide water and electrolyte drinks during heat waves, during power outages or other emergencies. And then we teach kids and families how to create their own emergency food and water kits. Another initiative is our partnership with the Strategic National Stockpile Program, and that's through the CDC to be an official point of distribution. So we work with the local county here, County of San Diego, to have stockpiles of medications or vaccines delivered to us in the event of a public emergency, so that we'll have the ability to dispense mass medications. The CDC is going to deliver up to 1,000 doses per hour within 48 hours during an emergency, and that avoids us having to store medications or having them expire or be exposed to extreme temperatures, being too hot or too cold. Our dental services are another area where we meet special needs. For patients that have mobility challenges, we bring the care to them. We use portable X-ray devices so we can provide treatment right directly in their wheelchairs. We provide telehealth oral health assessments to reach patients who have physical or transportation barriers. Our mobile dental unit does outreach. They go out to populations like parolees and partnerships with the Veterans Village of San Diego to take care of our military veterans and those with disabilities. Our community health workers, like I said before, they play a big role in these programs. They meet patients and they work with seniors to make sure that their homes meet requirements for safe living. So the elderly patients who might not be compliant with their diabetes treatment because they don't have basic necessities like a refrigerator, our community health workers can advocate for essential items. So if a patient has been using an ice chest instead of a fridge to store insulin, we'll work to provide a refrigerator. A lot of patients, especially seniors or patients with chronic illnesses, they worry about losing their housing if they ask their landlords for repairs or for modifications, so they don't want to ask their landlords for help. Our community health workers will step in to communicate with the health plans and the utility providers and advocate for the assessments and repairs without involving the landlords. So, we can identify different things, like if there's a fall risk due to an uneven walkway that can be repaved, to reduce the chances of falling and getting injured. So I think accessibility really it goes beyond just meeting those basic requirements. It's about how we can prepare for emergencies. We think about physical access. We think about the communication programs like our food pantry, the tailored dental services for the special needs patients. So we just want to, we not just to provide care, but to provide peace of mind, because I really think peace of mind is an actual determinant of health.
That is the first time I heard that, and I really love that. Peace of mind is a determinant of health. Might have to coin that and steal that. That's awesome. Definitely credit you. Um, I think you bring up a good point too about the role that health centers can play in built environment. Talking about cracks, and those are health issues. A crack in a road or air quality impacts health, and so not necessarily making it a going to your landlord. This is a health issue, and so you become that added advocate to get those things fixed. So thank you so much for that. Shane, would you like to also share a little bit about how your organization goes above or beyond the ADA needs or guidelines?
Definitely, definitely. So I think, one of which, much to what Tom had mentioned, it's really critical that you understand the disparity, especially the social issues, the social factors that the people are facing, that during type of crisis, they may actually exponentially increase barriers and challenges to them being able to be healthy, them being able to have a good quality of life. So not only going out to the community to provide the medical care itself, you kind of have to understand also, are there other social needs that they may have, especially in times of the natural disaster, heat waves and whatnot. I appreciate the fact that, they're making the kits and whatnot, but also it's internal training of your own staff, understanding and being ready for the challenges up ahead, understanding what the population that you're serving may have, so that they know how to really address the clients that you're serving. Part of which, for us, we hire from within the community. We provide services in over, I want to say, 54 different languages. So most of our staff come from all over the world. They're all immigrants for the most part, and they all have different culture, they all have different beliefs, but having them and training them to understand the population that you serve, the cultural aspect, the disparity aspect, especially including things like, some of the practices, what food that they can and cannot eat, what the preferences are, educating your community partners, one of which is the Houston Food Bank, not only just getting the food pantry ready and also having food fairs and whatnot, making sure that they're sensitive to dropping off the food or the type of meat or vegetables that are appropriate, or spices that are appropriate to the population that you serve, is really critical as well. And then with that, people that you are actually tagging on as your staff, as well as your health workers, that they're also in tune of the needs and collecting the information, assessing the gaps that are still there, and making sure that you work with your community partners as well as your own staff to be the biggest advocate of the community that you serve.
Thank you for bringing up that point, Shane, because I do think a lot of folks, either religious beliefs or around food, are really important, or just what their bodies can handle during emergencies. And that has to be considered for folks to stay healthy. If we're all in this shared humanity world together, then, let's consider everything and make sure we're not inhibiting any of those access things in emergencies. So thank you for bringing that up. This is our last question before we go to live Q&A. And this time I'm gonna go to Shane first, because I haven't really flipped it up too much. So the last final question we have for you today is, what do you wish you knew at your organization before experiencing an emergency? It's a big question. Go ahead, Shane.
It's unfortunate that you never know what's going to happen. I think for the most part, as especially the COVID pandemic, as we are then starting to hear the news December of 2019, we were not aware how big and how lengthy this emergency crisis was going to impact our own Houston area. For the most part, we were not even certain of the disease itself and how it would affect individuals' health, let alone those who are vulnerable, especially the elderly or those who are immunocompromised. With that said, the only thing we can do is make sure on a regular basis your crisis management or crisis preparedness plan, whether it's communicating with your community partners, whether it's actually making sure all your resources are in place, that is actually updated, as well as making sure that every one of your staff, as well as your community partner, has a copy of it so that they know exactly who to reach, how it's going to be able to be applicable when that emergency strikes. Part of which what we're able to identify is making sure that your media contact is continuously updated. And if there's any new media or partners in place, making sure that the information is updated appropriately and disseminated out, whether through your facility as well as your community partners. I think for the most part that directory, as well as the checklist, as well as making sure all the supplies and equipment's in place, is actually really critical. Regretfully, a lot of the supplies that you may have to update it on a regular basis because of expiration date, things like freshness, even water containers, so that you're making sure in case of the emergency, it's ready to be used. So that takes manpower. That takes a lot of staff time. It takes a lot of even volunteers to be able to check and see if things are already in place, things are available. Because next thing you know, your facility's water is turned off, or there's no power within the neighborhood, and your flashlight is not ready. You don't have batteries, you don't have water jugs. That can actually really impact the way you're able to serve the population.
Thank you so much. And I just, the reason this question is so important, because I think lessons learned are so valuable. And so thank you for sharing that. And so anyway, with that, Tom, would you like to share what you wish you had known before your first emergency?
Yeah, we wish we knew everything before experiencing an emergency. Honestly, the reason we create protocols is usually because something went wrong. And so every plan we have today comes from a lesson that we learned, and sometimes we learn the hard way. The need for backup systems and power. We always knew that having backup systems were important, especially for patients with disabilities. But what we didn't fully I'd say anticipate was how challenging it would be to get those systems, backup generators, the infrastructure upgrades. They're expensive and they take time and planning and resources. In one of our earlier experiences with a power outage, we really saw how not having backup power really affected our operations. And it made it clear that having backup generators wasn't just a nice thing to have, it's a necessity. Another is really understanding the value of partnerships, and I think Shane talked about this. Early in our planning, we thought about supply shortages, especially for the medications that I talked about. We learned when during our partnership with the Strategic National Stockpile Program, and today, like I said, we're a point of distribution, meaning we can get medications delivered within 48 hours during an emergency. And if we'd known how impactful these partnerships could be, I think we would have started building them a lot sooner. Assigning emergency preparedness roles within our organization, we learned the importance of having defined roles and responsibilities during an emergency. So now we have an emergency preparedness team, and it's made up of staff members with specific roles. We have incident commanders who oversee emergency response and decision making. We have patient support leads who focus on helping patients with disabilities and mobility challenges like we talked about. We have communication coordinators, and they relay information to patients who have mobility challenges or disabilities as well, and they can relay information to our partners. We also have logistic leads, and they manage the supplies and the equipment and distributing resources like the medications and the N95 masks. A big one that I think we wish we knew was investing in insurance coverage. So emergencies, they come in a lot of different forms, and we'll prepare for natural disasters, and we'll prepare for other events like active shooter situations. So we have comprehensive emergency insurance coverage, and that includes property protection during natural disasters, and coverage for equipment failures, and then liability coverage for business operations if there's downtime. And because there have been a lot of concerns with active shooter incidents lately, we have specialized active shooter insurance coverage. And that provides resources for recovery like trauma counseling, staff support, legal support, and rebuilding if that were to happen. So yeah, every emergency has definitely taught us something, and that's that it's an ongoing thing, and we're constantly trying to learn and adapt. But today I think we're much more prepared to meet the needs of our patients, and just try to make sure that nobody gets left out or gets left behind.
Wow. Well, thank you both so much. And I agree. I think what I'm also taking away today, in addition to a plethora of other information, is the nimbleness that we have to be, our protocols. What type of emergency are you responding to? Is it fire? Is it flood? Is it this? And still needing to make sure we're considering populations that have either disability or access challenges. And so I really appreciate you all. So thank you so much for your wonderful insights. We're now going to turn it over to our live audience for some of their questions, and we have some for you. You might have seen some go through the chat. Um, we'll see how many we get to. We'll probably spend maybe 5 or 8 minutes just so we can tie up the rest of the webinar. So one of the questions for Tom is, can you share any recruitment strategies for bringing staff with the skills of a medical cultural liaison into a healthcare or public health organization?
Yeah, we definitely make it a point to recruit staff from within our communities that are familiar with our processes. A lot of them have received care from our health centers. We have 22 health centers across San Diego, and many of them are referred from our staff, our community health workers, our cultural liaisons, our community health access departments. And so they're a big part of our operations, and that includes compliance and risk and emergency and mitigation. So, we try to prepare well in advance for making sure our operations run smoothly, especially with risk. And that includes all of our supplies and equipment and all our technology. We just try to focus on forecasting what the needs are going to be of our patient populations and then building initiatives based on that. So I think it involves a lot of planning, a lot of building within our community, a lot of word of mouth, so that things are organic within our organization, and just build naturally as they have. Most of our systems, like I said, come up based on a need. It's not because we really followed a manual. It's just we have this right, something else happened. How can we address this now? Great, well, let's do that and let's add it to our emergency preparedness planning. So that's kind of what we focus on to anticipate needs of our populations and avoid disruptions like emergency preparedness plannings.
Yeah, definitely a learning health system. We learn as we go and build and construct. Thank you. This one is for both of you. So how are you both inclusive of patients and staff when doing CMS required annual drills and exercises? Are you able to work with your local preparedness healthcare coalitions on exercises or even other health centers to help meet the requirement?
I'll start with that. First and foremost, I know most of the health centers is a member of your state's primary care association. Having that collaboration with your primary care association is really critical, mainly because a lot of times you're able to also leverage additional resources for the auditing aspect, as well as being able to look at any particular best practices that they're also learning from other health centers that face other emergency incidents that you have not thought of, you have not encountered, and being able to roll that into your preparedness plan. What part of which is we wanted to make sure that our partners itself is actually at the table. So a lot of times we'll host different meetings to make sure that the review of the preparedness plan itself is done together as a group. In addition, the training itself, a lot of times, including on a monthly basis, we'll have each location have a checklist walkthrough, as well as to kind of look at things that we need to make sure is in place: the crash carts, the water jugs, the batteries, the emergency vests, and whatnot. in addition to making sure that we have mock incidents that we can actually roll out for a particular site team lead to be able to act out with their team so they are aware and they're participating in a mock incident. So we then have them kind of document what happened and how do they react to it and what they did to address the situation, and then report back to our quality improvement meetings. So I think like Tom had mentioned before, nothing beats the experience itself, and nothing beats actually having the activity acted out or actually in place, and being able to take some of the lessons learned and be able to then modify your plans a little bit or your processes a little bit, because there may be little minute details that you have not thought of that actually practicing it or actually having the event will allow you to improve your process over time.
Yeah, I think those are great points. There's not just CMS requirements. There's so many other requirements. There's requirements from the state, from the health plans, local requirements, from HRSA, government funding. But I agree. I think it starts with communication and just training, comprehensive training. We try to engage all of the team members in the process by just providing education on the CMS standards, on the state standards, local utility standards, and whatever applies to their roles. So, and this is clinical staff, this is administrative staff, to support the functions that everyone can understand what their part is in maintaining compliance. So we try to be inclusive and create opportunities for staff to provide their feedback to what works and what doesn't work. So there's collaboration. So when we update our policies or our workflows, they'll align with CMS requirements. We involve the frontline staff, the patient service representatives, in pilot programs or working in groups. So I think this helps us figure out what the practical challenges are so we can improve our process. And then, providing training materials and training sessions that are going to be available to everyone on the intranet or the website, and making sure they're in multiple languages and formats as needed. So I think this is super important, especially for a multicultural workforce where inclusivity doesn't just apply to patients, it applies to our staff too, who have linguistic and cultural differences. And then on top of that, just regular audits, the risk manager, it needs just regular audits and performance reviews and just involving staff participation. So we try to emphasize open communication so that staff feel comfortable in asking questions and bringing up any potential issues without, any fear of being reprimanded or retribution. Yeah.
No, I appreciate that. Thank you so much. And I'm realizing the time. I really would love to squeeze in one more question, and if we can get it done in about a minute or two. They're both really great questions. And I'll actually put both of them, and you can answer them in the chat as well. But how are you engaged by public health departments for preparedness, state, local, or both?
I'll let you start, Shane.
I think for the most part, one of the things over time that we've learned is, I know with the state and local entity itself in Texas, the activity itself sometimes take a little bit of time to roll out, we're finding. But I think it's also being at the table, when they're doing the planning aspect, when they're actually delegating and disseminating the resources aspect, to make sure that you're there championing for the people that you serve and bringing up issues and barriers and challenges and whatnot, so that you're able to help them make the decision or at least allocate the resources or the plan itself.
Yeah.
Go ahead.
No, I agree. I think at the state level, we try to participate in programs that align with the statewide goals, like the disaster plannings. We have tabletop exercises throughout the state of California, and how do we allocate the resources statewide that are compliant with regulatory requirements. And that means, a lot of times that means sharing our data, attending those tabletop training sessions and working on public health campaigns. On the local level, we maintain close relationships with San Diego County Health Department to address specific needs within the communities. And we're involved in planning committees like the Emergency Preparedness Task Force locally in San Diego, the Police and Fire Department, where we can collaborate with all the local agencies, local hospitals, all the stakeholders to develop, our strategies and our plans. So it just make sure that we're all aligned with the broader public health information structure, and we can tailor our efforts to our communities and to the populations that we serve.
Thank you so much. There are other questions related to supporting your internal staff. I wish we could get to them all, but I do have to turn it back over. But I do want to thank you all for sharing your insights. We are going to share some resources, and I'll hand it back to you, Kara.
Thanks, Elena. And thanks so much, Tom and Shane, for joining us today. I wish we had 3 hours to hear more about all of the wonderful work that you're doing. We definitely encourage all of our audience to get in touch with our speakers, with us, to learn more about the ways that you can deliver these insights and practices in your health center. Just because we're at the top of the hour, I'm not going to go through these resources one by one, but a reminder that you will receive these slides in an email, and they'll also be available on our shared Google site within about a week of this session. And just a quick reminder that this is a 4-part series, and this is session 2 of 4. So we hope that you'll join us for session 3 in February on extreme heat. And then we know it's to the top of the hour, but we please invite you to take a moment to complete the Zoom evaluation to help us improve this activity. The NTAPs are really proud to offer free training and technical assistance to the public. And this is only possible because of people evaluating and responding to our surveys. So if you don't have time to complete it today, a link will be shared in the follow-up email for all attendees next week through Zoom. But when you close out of the session today, it will automatically pop up. So if you can just take 2 minutes to share some feedback, we really appreciate it. We really read them, and we really want to be responsive to them. A quick round of applause again for Tom and Shane for joining us. Thanks again, y'all, and we'll see you in February.
Happy holidays, everyone.